Now we are talking about bitter principle containing fruits. First of all, we will discuss together a very important medicinal fruit. It is called cocculus. Cocculus, or it is also called a fish berry. This name is due to the effect on the fish. Um, Previously, these fruit were used to causing killing of the fish, and so this is called fish berry. The main constituent of this drug is bicrotoxin, which is a very important bitter principle. It is a strong CNS stimulant drug. It can be used as antidote for the barbiturate poisoning. Barbiturate is a CNS depressant. If the patient is toxify or take a large dose of barbiturate, this will cause depression. So we depression or and toxicity, in fact. So we can use intravenous injection of picrotoxin to detoxify or to antidote as antidote for the barbiturate, because picrotoxin is a CNS stimulant drug. Picrotoxin itself is a very toxic drug, and consequently, the cocculus fruit is also a toxic fruit. The second drug is capsicum. Capsicum, and it is called the cayenne pepper. Take care to differentiate between cayenne pepper, black pepper, white pepper, and long pepper. These are different medicinal drugs. Cayenne pepper, it is a different fruit. It is also called chilies. The odor of chilies is slight characteristic, and the taste is extremely fiery and pungent. The pungent taste due to the constituent of the capsicum itself. One of the most important features of capsicum is that it is strongly stimulatory and irritant to the skin and the mucous membrane. So if it is inhaled or sniffed by the patient or by the person, it causes a stimulatory effect. It causes irritant effect to the nasal mucosa. The fruit, as we see in these pictures, the fruit is divided into two main loculi by a membranous longitudinal descendant. The descendant is the septa between the two loculi. This descendant has the seeds on it. Each loculus contains 5 to 10 seeds, loose or attached to the descendant. What is the importance of descendant? We will see that it has a very important constituent in localized in the descendant. The constituent of capsicum, it contains mainly pungent principle called capsaicin, and this is located in the descendant. It also contains red coloring matter, capsaicin, and this is located in the mesocarp, in the fleshy mesocarp, which is the red part of the fruit. It also contains flavonoid, fixed oil, and protein. It also contains volatile oil and ascorbic acid. What is the use of capsicum? Capsicum can be used externally or internally. Externally, it can be used as a rupefacient and counter irritant in the form of ointment. And internally, it is used for the treatment of dyspepsia as a stomachic drug. It is approved by Commission E for muscular tension and for rheumatism. Side effect and toxicity of capsicum. Due to the pungent principle capsaicinoid, These are strongly irritant to the mucous membrane, as we mentioned before. It causes irritation and it causes sternotatory effect. These pungent principles, capsaicinoids, are very irritant. Inhalation of capsicum can produce a form of allergic alveolitis. Excessive ingestion, if it is used by large amount, it causes GIT irritation, it causes hepatic or renal damage, and it may interfere with the monoamine oxidase inhibitor. This is an enzyme responsible for the inhibition of monoamine oxidase, and consequently it can affect the antihypertensive therapy due to their effect on monoamine oxidase or MAO inhibitor. It may increase the hepatic metabolism of the drug, and this is a general rule. If the drug or the herb or the fruit affecting the hepatic enzyme, so it will affect the metabolism of drug, and it is very dangerous, especially in the case of low therapeutic index drug, which will be affected easily with this metabolism change. As a point of interest, capsicum can be used as a self-defense pepper spray, and this is because the use of capsicum as a self-defense spray due to the immobilization effect. It has short-term immobilization effect. Capsicum is used as a human self-defense spray. It can cause immediate blindness for about 30 minutes, and this is a reversible action, so it will not be harm to the person who is affected, just causing blindness for certain time and immobilization effect. The the second drug or the third drug here is the colocynth. Colocynth is also called as a bitter apple. Don't confuse colocynth with cocculus. These are different drugs. Take care. Colocynth, which is the bitter apple, due to the appearance of the fruit, it resembles somewhat apple fruit, but it is very bitter in taste. The pithy pulp is the main part to be used. The pithy pulp, it is the official part. The official part is the pithy pulp, which is the mesocarp and the placenta. It is odorless but has intensely bitter taste. It contains many constituents, mainly alkaloids, which is which has a purgative effect, and also it contains resin with also a purgative effect, and a highly oxidized tetracyclic triterpenoid. These are called cucurbitacin. For example, cucurbitacin B and cucurbitacin E are the most important cucurbitacins from colocynth. So we have here alkaloid with purgative effect, resin with purgative effect, and the triterpenoids, tetracyclic triterpenoids, are mainly cucurbitacin B and E. Gastrointestinal tract stimulant as a powerful purgative or a cathartic purgative, but it is not used alone, but usually used with hyoscyamus as antispasmodic, because it is a very severe purgative effect, very efficient, very stimulant effect to the peristaltic movement. So it is not be used alone. Why not be used alone? Because if it is used alone, it will cause gripping effect to the patient. So we can use hyoscyamus as example of antispasmodic drug to counteract the gripping effect. Colocins also is used as a potent cytotoxic drug due to the presence of cucurbitacin, and due to the toxicity of this drug, it is now limited to be used as cathartic purgative. It is only used or limited. The use of colocins is limited to the cytotoxic effect. Several abdominal pain, vomiting, hemorrhage, diarrhea, drastic irritation of the GIT mucosa are of the side effect of colocins. The dose of 4 to 6 gram may be fatal. This is a very important thing, that the dose not reach 4 or 6 gram of the powder. Powdered drug cause severe pain if it comes in contact with the nasal mucosa membrane. Powder of colocins not to be given to children, not to be given to pregnant women or feeble subject اللي هم الأشخاص الضعاف. Should not be given to nursing mother as it is excreted in the milk and the infant will be affected with this excretion. In the presence of hemorrhoids and inflammatory condition to stomach and intestine. So if the patient suffering from hemorrhoids or inflammatory condition in the GIT, so we should not use colocins for any reason, especially internally.